This is Facilitated Stretch by Christina Longobardi Paradiso. We'll start our client seated, having them grab the underside of the table or chair with the right hand and depress the shoulder, dropping their head to the left. We'll begin our compression down the neck, starting at the top of the trapezius and compressing all the way down, maybe finding some points to hold, and then swapping to the other side. Client will move the left hand and will continue to depress the left shoulder, drop the right ear over, and begin to compress all the way down the other side. You can do this for as long as feels good, up to 1 minute on each side, not overstretching the neck and not causing any pain. Simply taking the neck and the shoulder to its edge to help aid in release. And we'll go ahead and just have you. Our client comes to laying down. We take both of our feet and we plant them right onto the shoulder blades. We'll grab the undersides of the neck, finding that nice mastoid process. And bending the knees, we'll push into the shoulders and pull the neck. So thinking we could bring the client's head towards our pelvis. Creating some traction. You can do this as many times as feels good for the client. Moving away from the neck, we then will come off the table, have the client grab your wrists. You'll bring one foot to the table or to the edge so you can hold yourself and not move. And then we begin to gently pull. So creating some traction in the armpits. Again, the client keeps their hands wrapped on your wrists. We shake it out and do it a few more times, maybe changing legs. Finding what feels best for the client. Next, we'll come to a seated twist. The client will bring the right leg over the left, right foot plants on the floor. We begin to bring the under leg in a bent position, making it so the client's hips are both down on the mat or the floor or the table. Left arm revolves up towards the ceiling, and then we twist, bringing navel to spine, bringing the outside of left elbow to the outside of the right thigh, and pushing through the right palm. So here's where the therapist comes in and aids in the stretch a little bit further. We plant our hand firmly on the back and begin to rotate the client's chest open towards the right. We then grab the left hand, stabilizing in the back, and twist. You can use whatever helps the client stay in this pose. So our client fell over and we decided that if we put our foot up there and then pull him, that he can stay in that twist and get really deep. So we'll come to the other side and you'll see how that works without the foot. So left comes over, we twist again, have the client come into this twist on the other side. And then from there, we'll begin to twist and wrap and aiding in the opening, pushing on the back, opening the shoulder, and then taking the arm across the body. Stabilizing the back so when they take the arm across and we begin to pull deeper, that they have a nice base. So you can see here that this worked really nice with the right hand on, left arm pulling. And we change. You can hold this for as long as feels good for your client. Next, we'll come back onto the table. Both feet come flat, right on the rhomboids. We are not touching the spine at all. The client brings their hands back. We interlace hands with wrists. And then we begin to straighten the legs, creating a back bend effect for the client. We push directly into the back as they come to lift up and back, never releasing grip of the hands. After this stretch, we just simply palpate and notice what's going on, and we come to it one more time before lying down. Our next stretch, we're just going to get into the upper body. We'll bring the right arm across the chest, gently pulling for some traction and then compressing all the way down the tricep. We'll keep compressing and holding this up to 1 minute. We then take it out to the side, again grabbing wrists with your client, creating some traction here. If this does not work, if your arms are not long enough, we can then pin the pectoralis major muscle right underneath the armpit and begin to pull. So this is a pin and stretch here. The toe is pinning the pec and we are pulling through the arm. Be mindful of your client. Ask them if it feels good. Coming to hook underneath the elbow, we are just gently tractioning back, stretching all the way through the tricep, and then slowly planting the hand down, the fingertips face away from the client's face, and you just begin to press onto the tricep. Again, creating some good mobilization and stretch for the whole tricep area. We shake out all of these stretches and then we move to the other side. So taking the left arm across the body, compressing through the tricep. Compressing down the arm, and then pinning and stretching, bringing the left foot to the inside of the left pec or armpit, and pulling on that right arm. You can pull and release, or you can have a static traction hold here. Again, whatever feels best to the person on the table, and whatever feels right to the practitioner doing the stretch. Hooking elbows with your client and creating some traction as we pull back the tricep towards the head. Hand is reaching beyond the head. Trying to get some good stretch in the tricep. And then we plant the hand flat and again mobilizing through that tricep. Compressing down. And then eventually shaking it out and releasing the arm back down to its side.